Welcome to a doctoral student presentation of a dissertation proposal evaluation. This is for Seminar 6611, Doctoral Seminar 2, for the American College of Education. This American College of Education doctoral student presentation is presented by Amy Brown, Janet James-Benson, Patrick Williams, and Ray C. Wojdat. The dissertation selected for this presentation was entitled Mentoring, Self-Efficacy, and Nurse Practitioner Students, a Modified Replication. In order to understand the dissertation better, it pays to know something about nurse practitioners. Goodwin, 2013, states that nurse practitioners conduct physical examinations, manage chronic illnesses, order diagnostic tests, and interpret those tests in order to provide the appropriate medical treatment to patients. Some states require that nurse practitioners perform these duties under the supervision of a physician. The utilization of nurse practitioners is an effective use of staffing resources, as it frees physicians to focus on more serious issues and results in improved medical care for patients. Nurse practitioners can specialize in a variety of specific areas, such as family practice, women's health, geriatrics, oncology, pediatrics, psychiatry, and acute care. The goal is to provide each patient with appropriate, individualized care, so nurse practitioners should be perceptive and flexible. They should exercise patience and sensitivity to changes in their patients' conditions. Nurse practitioners also benefit from strong communication and organizational skills, which help them keep abreast of changes in their ever-changing, fast-paced, high-stakes work environment. Again, the study examined for this collaborative project is entitled Mentoring, Self-Efficacy and Nurse Practitioner Students, a Modified Replication. It was a dissertation submitted to Ball State University in Muncie, Indiana. The problem statement in the dissertation is large and complex and is supported by 4 paragraphs of background information. The problem statement is as follows, quote, research has documented a correlation between the relationship established between student and preceptor and the student's perception of self-efficacy and confidence in assuming the role of nurse practitioner, Hayes, 1997. The current study will re-examine the significance of the relationship between students and preceptors to determine if a relationship truly exists as evidenced by students' perceptions of self-efficacy and confidence. Neal, 2008, pages 3 through 4. The problem statement aligns with the purpose, which is to, quote, improve the generalizability of the findings by expanding the student population to include Midwest universities, end quote. Neal, 2008, page 7. The purpose does appear to align to the research questions, although there is a concern that the research questions are closed-ended and therefore limit the study's possible findings. The research questions that were articulated for this dissertation read as follows. 1. Does the number of clinical hours with a preceptor relate to self-efficacy of nurse practitioner students? 2. Do the number of clinical hours mentored relate to confidence of nurse practitioner students? 3. What are the perceptions of the students of a mentoring relationship? The articulated research questions led the researcher to adopt a mixed method study approach. In order to determine if there is a significant relationship between students and preceptors, as evidenced by students' perceptions of self-efficacy and confidence, qualitative measures had to have been used, such as interviews and surveys. Another important piece of this puzzle is the quantitative data, which will tell the story of the success rates of nurse practitioner students within the program. The literature review was comprised of 28 pages and began with a theoretical framework addressing self-efficacy. Each paragraph, which introduced new information, contained a heading. According to Neal, 2008, the focus was on three primary concepts: self-efficacy, precepting, and mentoring. The first paragraph provided an introduction which included who, what, where, and how. The author clearly identified nurse practitioner students as the group in focus. She discussed the nature of nurse practitioner education and introduced the concept of precepting, mentoring, as well as self-efficacy and self-confidence. The literature review adhered to the literature review structure and offered an introduction, a body, and a conclusion. The literature review included a number of citations of nursing articles addressing mentoring, self-efficacy, and precepting. In addition, the author discussed 3 studies which explained the relationship between the nursing student and the preceptor, but she indicated there is less available evidence of mentoring of nurse practitioner students. The review also indicated that the numbers of potential nurse practitioner preceptors actively engaged in precepting is less than desired. The review indicated that there is very little in the literature which addressed why preceptors are hard to find, how preceptors develop, and the attitudes of preceptors on precepting itself. The majority of the literature review focused on explanations of themes and concepts, such as clearly defined preceptor, mentor, nurse practitioner roles, responsibilities, and fears, as well as clearly detailing why preceptors are needed. In addition, the review provided a comprehensive outline of essential components of an effective preceptor program, which included standards and recommendations from national nursing organizations. Although this chapter did not highlight any future research recommendations, it offered recommendations for clinical experiences for nurse practitioners, which necessitated a clear understanding of the student's perspective. The mixed method research methodology used addressed the perceptions of nurse practitioner students on the mentoring of instructors and how this affected the students' confidence and performance. According to Pirlot and McKinnon, 2016, using a correlational descriptive analysis study helped to determine the relationship of students' perceptions of mentoring in relation to confidence and performance. To further determine the relationship between mentoring perceptions, confidence, and performance, researchers used open-ended qualitative questions to understand viewpoints of students. The mixed methods research design included several instruments for measurements. Amongst these were 1. Freeman's Mentoring Survey from 1989, 2. Grundy's Confidence Scale from 1992, and 3. A self-efficacy scale, which was made according to Koppel in 1980. According to Neal, 2008, those instruments used a Likert scale, except one which is modified to a Likert scale to measure the correlation of mentoring versus self-efficacy. According to Zarabi, this is a comprehensive research design due to the researcher using a descriptive quantitative survey and providing further evidence with qualitative research questions to confirm the descriptive analysis. According to Pirlot and McKinnon, 2016, a correlational study is logical due to the nature of the study, which is to determine the relationship between mentoring and self-efficacy amongst nurse practitioners. In conclusion, Neal, 2008, stated that the study revealed that the single most predictive factor for self-efficacy and self-confidence is the length of time the student works with the preceptor as measured by months of clinical rotation. It is our hope that you enjoyed our presentation of Terry I. Neal's 2008 dissertation on mentoring, self-efficacy, and nurse practitioner students, a modified replication. In this, we covered the dissertation's problem statement, literature review, and research methodology, and we extend best wishes to you, to all of you, for the successful completion of your own dissertation endeavors.